So mara yangu ya kwanza kukuja hapa, experience yangu naweza sema ni kwamba nikikuja unawelcomeiwa, ulizwe kama unaingia family planning. Then unaulizwa unataka gani. Alafu ukichagua wakwambia hiyo hayuko but tunataka kukupe fulani. So unapata kwamba saa zingine unaweza kubali uwekewe kitu huku taka.
So generally for reproductive health commodities, the main challenge that we have are the erratic supplies. We have quite a huge population that we serve with family planning, and so the commodity supply, if it doesn't meet this need, we have clients who may come and they do not get the commodity that they require.
The collaboration between the Ministry of Health, UNFPA and KEMSA through the last mile assurance, the LMA, has really improved our supply chain accountability, specifically for the reproductive health products, proper documentation, enhancing oversight, supervision and mentorship, so impacting knowledge on county facility personnel and ensuring that everything really is accounted for.
The last mile verification exercise reinforces both transparency and accountability because it provides end-to-end visibility of the data from the national level to the health facility.
We're the world's largest procurer of reproductive health supplies, and we're accountable to stakeholders at all levels, to donors, to government, and most importantly, the women at the local level. So it's really critical to ensure that we have visibility to the last mile.
One of the most game-changing aspect of this partnership is that the development partner, in this case UNFPA, comes in to help the county to implement its own strategies. So we design together, we quantify products together, we design the management system and walk the journey together.
2025 last mile assurance for Kenya in the country assessment becomes quite innovative in that we have used the lessons learned from previous experiences to strengthen the LMA ICA component.
The logistics management information system has provided a mechanism through which facilities can be able to accurately focus on their need. There is therefore complete visibility from the KEMSA warehouse all the way to the point of issue to the client, and that is at the facility level.
When we find the gaps identified, we do instant mentorship and also use the LMA to plan for long-term capacity strengthening from both the partners at KEMSA, at the Ministry of Health, and also at the county.
I really want to appreciate the supervision today that we had with the LMA. It has been quite enriching. We had a few gaps which were noted in terms of small documentation again on the nitty-gritty issues of which we've picked as a facility, and we are going to really improve on them.
Before the assessment, we used to experience more than 13% stockouts. We've been able to reduce it from 13% to currently 6%, which has led to improvements as well on our order fulfillment rates, which now for family planning commodities, the order fulfillment rate is at 100%.
We do the quarterly stock reviews, and so we are able to know what commodities we have, what commodities are above our stock levels, what commodities are below our stock levels, and at the county level we are able to rationalize and redistribute what we have in excess in one facility. We are able to redistribute to a facility which is a high consumer but have lower levels of their commodity.
The client has a choice, and when you have all the choices, then she can make an informed choice and you can be able to offer her the service.
Nimekuwa nikikujia dawa huku Gilgil Hospital na nimekuwa na option ya kuchagua dawa yenye ninataka according na venye inanipeleka vizuri. Hizi dawa nimekuwa nikitumia zimekuwa zikinisaidia according kuna time yenye ninataka kupata mtoto mwingine next.
What we want is at the end of this project cycles or program, we are able to continue with the issues around accountability, proper oversight, supervision, data visibility through ILMS. We don't want a touch and go. We want this to remain institutionalized.
The philosophy is to strengthen the system, identify the gaps, provide solutions, on-site mentoring. So it is a very constructive exercise. I believe that this is an exercise that brings a lot of improvement to the supply chain management system in Kenya.